Did you know the fluid around the brain can get infected? Meningitis is an infection of the fluid and protective layers of tissue that surround the brain and spinal cord. It is important to diagnose and treat meningitis as quickly as possible. Hi, I'm Dr. Beth, and I'm a pediatrician at SickKids. Let's talk about meningitis and 5 important things to know to help keep your child healthy. Your brain and spinal cord are protected by thin layers of tissue called the meninges and by fluid called cerebrospinal fluid. Meningitis is the term used to describe an infection of the meninges and cerebrospinal fluid. When they become infected and swollen, there can be pressure on the brain and spinal cord. Meningitis can affect people of all ages, but babies and young children are at higher risk from this disease. If you think your child has meningitis, it is a medical emergency, and you should seek help immediately from a healthcare provider. 1. How do I know if my child has meningitis? The symptoms of meningitis vary depending on the age of your child. Meningitis looks different in babies than in children. Symptoms can develop within a few hours or can develop over several days. If your child is 2 years of age or older, they may have a high fever, severe headache, and a stiff neck. They may also have nausea or vomiting, be sensitive to light, be confused, or be drowsy. In babies, symptoms of meningitis are different. You may notice your baby is not moving or doing much, is irritable or cranky, has difficulty feeding, is vomiting, or has a fever. Meningitis at any age can also lead to seizures. 2. How is meningitis diagnosed? If your child has symptoms of meningitis, take them to see a healthcare provider immediately. To diagnose meningitis, a sample of your child's cerebrospinal fluid is tested. This sample is collected during a procedure called a lumbar puncture or spinal tap. During a lumbar puncture, a needle is inserted into the lower back where cerebrospinal fluid is easily available. A small amount of fluid is then tested to identify which virus or bacteria is causing the infection. Knowing what type of virus or bacteria is causing your child's illness is important to making sure they get the right treatment. 3. What causes meningitis? Meningitis is usually caused by an infection from a virus or bacteria. If meningitis is caused by bacteria, it is called bacterial meningitis. Bacterial meningitis can be very dangerous and is a medical emergency. It can cause brain damage, hearing loss, learning disability, and sometimes death. If meningitis is caused by a virus, it is called viral meningitis. Viral meningitis is the most common type of meningitis and is usually not as dangerous as bacterial meningitis because most viruses do not need specific treatment. While there are exceptions, most viruses that cause viral meningitis will go away on their own. 4. How do you treat meningitis? The type of treatment will depend on the type of meningitis your child has. Viral meningitis usually gets better on its own without any specific treatment. Children can recuperate at home and usually feel better in 7 to 10 days. However, if your child has bacterial meningitis, they will need antibiotics given through an intravenous line. It is important to start treatment as soon as possible. The full course of treatment for bacterial meningitis is given intravenously. The length of treatment depends on the type of bacteria and the severity of the infection. 5. How do you prevent meningitis? Some forms of meningitis are contagious and spread through close contact, such as coughing, kissing, or sharing utensils. However, it doesn't spread as easily as common colds or flu. If anyone in your family has had close contact with someone who has meningitis, see your healthcare provider. If your close contact has bacterial meningitis, you may need to take antibiotics to reduce your risk of infection. Close contacts include a boyfriend or girlfriend, family members in the same house, people at school or daycare with the person who has meningitis. Meningitis is an infection that must be reported to the public health department. The public health department in your area helps identify close contacts of a child who has been diagnosed with meningitis and makes recommendations about preventative antibiotics for close contacts. This will depend on the type of meningitis and on the closeness of the contact. Meningitis is a serious condition, but you can help to protect your child by making sure they are up to date with all their vaccinations. Several of the routine vaccinations that your child receives help to prevent many types of bacterial meningitis. Following the recommended immunization schedule and avoiding delays in vaccinating help keep your child protected. Talk to your child's healthcare provider to learn about the many effective vaccines that are available to protect your child. I hope you found this video helpful. Subscribe and visit AboutKidsHealth.ca for more. Thanks for watching. Stay healthy, everyone.